Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is attachment of the scapula. So today we will discuss about the attachment of the scapula. So let us start. In the first part we will try to cover the anterior or ventral or costal surface. In the anterior or ventral or costal surface, there is one fossa. There is one fossa present called subscapular fossa. And it is for the attachment of subscapularis muscle. So what happens? In case of anterior or ventral or costal surface, there is one fossa present that is known as subscapular fossa, and here is the attachment of the subscapularis muscle. And in the next part, the posterior or dorsal surface, here spine divides the surface into two part. Spine divide into two part. One is supraspinous fossa, and second one infraspinous fossa. It is above the spine and it is below the spine. Here is the attachment of spinatus muscle. And in case of infraspinous fossa, here is the attachment of infraspinatus muscle. So in case of supraspinous fossa, there is the attachment of supraspinatus muscle, and in case of infraspinous fossa, there is the attachment of infraspinatus muscle. So these are the attachment of the posterior or dorsal surface. Now to the medial border. In case of the medial border, we will discuss in the order of above to downwards. Above to downwards. The first muscle is levator scapulae. Number 2, that is the rhomboidius minor. Number 3, that is the rhomboidius major. Number 4, that is the latissimus dorsi. And to the medial border, the anterior surface is superior to the inferior angle and attachment of serratus anterior also. Now to the lateral border. In case of the lateral border, there is the we will discuss it again from above to downwards, and here the attachment of number 1 is infraglenoid tubercle, and here the attachment of long head of biceps brachii. Then number 2 is teres major, Number 3, that is teres minor. And number 4, that is the, in case of inferior angle, latissimus dorsi. Now, in case of inferior border, no, first of all we start from the superior border. In case of superior border, there is a notch close to the coracoid process called suprascapular notch. Suprascapular notch. And this notch may be converted into a foramen called suprascapular foramen. And just medial to this notch, the suprascapular, here is the attachment of inferior belly of the omohyoid muscle. So what is the muscle? Omohyoid muscle. Then the spine or spinous process. In case of spinous process, there is the attachment of the lower lip, attachment of deltoid muscle. And in case of the upper lip, there the attachment of trapezius muscle. Now, in case of Acromion process, there is a smooth articular surface, facet for the attachment of acromial end of the clavicle. And forming the acromioclavicular joint. And here the attachment of acromioclavicular ligament. Then the coracoid process. Now at the tip of the coracoid process, here the attachment of conjoint tendons of the coracobrachialis and short head of biceps brachii. So in case of coracoid process, at the tip of the coracoid process, there is the attachment of the conjoint tendon of the coracobrachialis and short head of the biceps brachii. And at the midpoint of the coracoid process, they are the attachment of pectoralis minor. And here is a important point, that is the long head of the triceps that is present in the supraglenoid tubercle. Now some clinical anatomy part. Scaphoid scapulae. What is the scaphoid scapulae? When the medial border is more prominent and exposed from outside in comparison to others, and this condition is called scaphoid scapulae. Now what is the reason? Reason behind this is the when the serratus anterior muscle, serratus anterior muscle is becoming paralyzed. So what is the reason? The reason behind this is that when the serratus anterior muscle is becoming paralyzed, and due to the injury of long thoracic nerve, the effect is prominent of the medial border of the scapulae, that is known as scaphoid scapulae. So what we have discussed in the video, we have in the first point we have tried to cover the attachments of the scapula. In case of that part, we have already discussed anterior or ventral or costal surface. We have discussed that there is a one fossa present, that is known as subscapular fossa, and here is the attachment of the subscapularis muscle. Then the posterior or dorsal surface, here the spine comes. The spine divides into two parts. One is in the upper part, that is supraspinous fossa. In the lower part, that is the infraspinous fossa. In case of supraspinous fossa, there is the attachment of supraspinatus muscle, and infraspinous fossa has the attachment of the infraspinatus muscle. And then comes to the medial border. And here we will discuss from the above to the downwards. First, the levator scapulae, then rhomboideus minor, then rhomboideus major, then latissimus dorsi. These four muscles are present in the medial border. And to the medial border, and in the anterior surface, there is from superior to inferior angle, here the attachment of the serratus anterior. And here is one clinical anatomy. You guys also know that the scaphoid scapulae. We will discussed already that part. Then to the lateral border, then we have discussed about the lateral border. Here also from above to downwards. Here the infraglenoid tubercle has the attachment of the long head of the biceps brachii, then the teres minor and teres major. And in the inferior angle, here is the attachment of the latissimus dorsi again. Then the superior border, there is a notch close to the coracoid process called suprascapular notch, and this notch may be converted into a foramen which is known as suprascapular foramen, and just medial to this notch, suprascapular notch, has the attachment of the inferior belly of the omohyoid muscle. Then the spine or the spinous process. In case of spinous process, the attachment there are some attachment in the lower lip. There the attachment of the deltoid muscle, and in the lower lip there is the attachment of the trapezius muscle. Then the acromion process. In case of acromion process, there is a smooth articular facet for the attachment of the acromial end of the clavicle, that is known as acromioclavicular joint, and here is the attachment of the acromioclavicular ligament. Then the coracoid process. At the tip of the coracoid process, there is the attachment of the conjoint tendon of the coracobrachialis and the short head of the biceps brachii. And at the midpoint of the coracoid process, the attachment of the pectoralis minor, and here is a noted by point, that is the long head of the triceps is attached in the supraglenoid tubercle. Then the clinical anatomy, the scaphoid scapulae. What is scaphoid scapulae? Scaphoid scapulae is nothing but when the medial border is more prominent and exposed from the outside in comparison to others. That condition is particularly known as scaphoid scapulae. And what is the reason behind the case is when the serratus anterior muscle is becoming paralyzed due to the injury of the long thoracic nerve, and the effect is more prominent of the medial border of the scapula. So this is our today's short topic. We have already covered the scapula. So you guys, if you have any query or any doubt, you can comment down in the comment section. Do like, share, subscribe to my channel, and thank you so much for watching the entire video.